What is cognitive behavioral therapy, or CBT? Well, CBT is a type of talk therapy designed to help individuals understand the relationships between their thoughts, emotions, and behaviors. The core principle of CBT is that our thoughts affect our feelings and our feelings influence our actions. By learning to identify and challenge negative or irrational thoughts, individuals can change how they feel and act, leading to improved mental well-being. Key principles of CBT. First, thoughts influence feelings and behavior. Negative thoughts can lead to negative emotions, which often result in destructive or unhelpful behavior. Next, challenging unhelpful thinking patterns. CBT helps you identify distorted or irrational thought patterns that contribute to negative emotions and behaviors. Finally, behavioral changes. By focusing on actionable steps, CBT encourages positive behavior change that reinforces new thought patterns. How CBT works. CBT is typically short-term and structured, with a focus on solving current problems rather than diving deep into a person's past. Here's how the process usually works. Goal setting. The therapist and patient collaborate to set specific, measurable goals that the patient wants to achieve, such as reducing anxiety in social situations. Identifying negative thought patterns. Patients are encouraged to pay attention to their automatic thoughts, which are often irrational or distorted. Cognitive restructuring. Once negative thoughts are identified, the therapist helps the patient challenge and reframe these thoughts to make them more realistic and constructive. Behavioral experiments. Patients are often given homework to test out new thought patterns in real-life situations, reinforcing positive behavior changes. 7 core techniques used in CBT. CBT employs several practical techniques to help individuals shift their thought patterns and behaviors. Here are some of the most widely used methods. 1. Cognitive restructuring. This involves identifying and challenging negative thought patterns. Patients learn to replace irrational thoughts like "I'm not good enough" with healthier, more balanced thoughts such as "I am capable of achieving success." 2. Exposure therapy. Often used for anxiety disorders, this method helps individuals face and gradually become less sensitive to their fears by exposing them to the situation they fear in a controlled environment. This reduces avoidance behaviors, which usually reinforce anxiety. 3. Thought records. Patients are asked to write down their thoughts, emotional reactions, and behavioral responses during stressful situations. This helps identify patterns and enables the therapist to guide the patient through rethinking their responses. 4. Behavioral activation. Especially useful in treating depression, this technique encourages individuals to engage in positive, rewarding activities, even when they don't feel like it. By increasing activity, patients experience more pleasure, reducing depressive symptoms. 5. Problem solving. CBT teaches patients to break down overwhelming problems into smaller, more manageable steps. Patients learn to evaluate different solutions and implement effective strategies. 6. Relaxation techniques. Used to manage anxiety and stress, these techniques include deep breathing, progressive muscle relaxation, and mindfulness exercises. These tools help individuals control their physiological response to stress, creating a more relaxed state of mind. 7. Graded exposure. Used for treating phobias and anxiety disorders, graded exposure gradually introduces patients to situations that provoke fear or anxiety. The goal is to desensitize the patient to their fears, making them more manageable over time. Benefits of CBT. CBT offers a range of benefits for individuals struggling with mental health conditions. It is widely recommended by therapists, psychologists, and medical professionals due to its proven effectiveness. Firstly, CBT is effective for multiple conditions. It is widely used to treat anxiety, depression, PTSD, phobias, eating disorders, and OCD, among others. Research consistently shows that CBT can produce long-lasting improvements in mental health. Secondly, CBT is short-term and structured. Unlike traditional talk therapies that can take years, CBT is often completed within 8 to 20 sessions. This makes it a cost-effective and time-efficient option for many patients. Thirdly, CBT empowers individuals. One of the key benefits of CBT is that it equips patients with lifelong skills for managing their mental health. Patients learn to become their own therapist by identifying and challenging negative thoughts on their own. Fourthly, CBT is customizable. It can be tailored to individual needs, making it effective across a variety of age groups and cultural backgrounds. It can be used in individual therapy, group therapy, or even through self-help books and online programs. Lastly, CBT is evidence-based. It is one of the most researched and proven therapeutic approaches. Numerous studies have shown that it can be just as effective as medication for treating depression and anxiety, and it often provides more long-term results. Common misconceptions about CBT. Despite its popularity, there are some misconceptions about CBT that can lead to misunderstandings. One common misconception is that CBT only focuses on thoughts. While thoughts play a key role, CBT also addresses behaviors and feelings. Another misconception is that CBT is just positive thinking. In reality, CBT involves realistic thinking, not overly positive or idealistic thinking. A third misconception is that CBT doesn't address the past. Although the focus is on current problems, therapists may explore how past experiences influence present thought patterns. Is CBT right for you? CBT is a highly adaptable therapy, but it may not be suitable for everyone. It requires a commitment to self-reflection and homework assignments between sessions. Individuals who are motivated to change their thinking patterns and behavior can benefit immensely from CBT. When might CBT be a good fit? If you're struggling with anxiety or depression, if you're open to actively participating in therapy, and if you're ready to practice new skills outside of therapy sessions, CBT could be very beneficial. However, CBT might not be a fit if you need immediate relief from severe mental health issues. Medication may be necessary first. Additionally, if you're unwilling to engage in self-reflective work, CBT may not be the best option for you. Conclusion. Cognitive behavioral therapy, or CBT, is an effective research-backed treatment that can help individuals manage a wide range of mental health conditions. Through practical techniques like cognitive restructuring, exposure therapy, and behavioral activation, CBT enables individuals to gain control over their thoughts, emotions, and actions. Whether you're struggling with anxiety, depression, or other psychological issues, CBT offers valuable tools for improving your mental health and overall well-being. If you found this video helpful, please drop us a line in the comments below and be sure to hit that like and subscribe button. See you in the next video.